Health Spotlight, presented by Community Health Network.
At one time, opioids were the primary source of pain relief for patients recovering from surgery.
In tonight's Health Spotlight, Lena Pringle looks into a new trend away from the pain prescriptions.
1 in 5 people who've been prescribed opioids to manage pain from surgery find themselves struggling to stop taking the drugs long after they physically recover. Opioid addiction has been called a crisis, but now there's a shift away from these kinds of painkillers after a procedure. Total joint replacement, tummy tucks, lung surgery.
Those are kind of at the top of my list of very painful procedures.
But any surgery can be painful to recover from. Dr. Michelle Hayamadian is a pain management expert at Ohio State. She's leading an initiative to minimize opioids for pain relief. She says patients should start preparing before surgery by taking acetaminophen at home.
We kind of load that up in the system in the day or so before surgery, and then that helps us have to give less opiates for their pain control.
During surgery, doctors use numbing medicine that blocks the pain transmission to the brain and spinal cord. Then after surgery, patients can take over-the-counter acetaminophen or ibuprofen and use an anesthetic patch like lidocaine.
Other types of interventions like heat, ice, elevation, those types of things, those can't be underestimated.
Dr. Hayamadian says data shows non-opioid pain management results and less nausea and shorter hospital stays.
Where we used to have patients that would require an overnight stay or two that are going home now after surgery.
Dr. Hayamadian says hospital data shows a 50% reduction in opioid pain medication use among hospitalized patients, and that reduction remains consistent for patients as they recover at home. She says while opiates do have their role, it's important that they be used as a backup instead of a first line of treatment. I'm Lena Pringle for Wish TV, wishtv.com, and like us on Facebook.